digital health incentive scheme, we have made various relaxations to the incentive scheme based on our experience over the last 3 months and based on inputs from various stakeholders. The main changes that are there, I'll mention in a couple of minutes, and then Sangamitra will run a small presentation which details out those changes, and then we would open it for questions, and we are happy to take input, suggestions, queries, clarifications till 5 o'clock. The main changes that have been made in the incentive policy are fairly, straightforward. The first change that has been made is that all health facilities who are registered on the HFR would now be available for taking this incentive. Initially, it was meant only for hospitals who had who had 10 or more than 10 beds. Now we have opened it for every entity which is registered on the health facility registry. Another important change that has been made is the reduction in the base level of transactions. So we had earlier prescribed that the transactions would be 50 transactions per bed per month. Now we have removed per bed criteria, and we have made it as uniform as 100 transactions. So any entity which does more than 100 transactions, they would be eligible for the incentive. And the third and the major change that has happened is we have included scan and share transactions also under the digital health incentive scheme. So if a facility makes scan and share tokens, which are generally government hospitals, they will be eligible for incentives, and also various digital solution companies. This relaxations would be applicable from April 1st, and we will utilize next fortnight to create awareness about the revised changes. I will now request Sangamitra to present her screen and give more details, and then we'll have question and answers. Thank you.
Thank you, Vikram sir. As sir has just pointed out that the relaxations in the existing policy have been made primarily for two reasons. First of all, to benefit all the stakeholders, and secondly, to make the policy more simpler so that people can understand it better, and the calculations for the incentives also is a simple, is in a simple manner. As we know that this scheme was launched in December last year. However, it was operationalized in January this year, which means that even if the facilities which register now can claim the incentives in the back date. Now, coming to the major stakeholders for this digital health incentive scheme, they are hospitals. Hospitals can be big hospitals, can be small clinics, they can be nursing homes. And we have made now a standard eligibility criteria for the transactions, which is 20 rupees per health record will be given to hospitals as well as the labs and imaging centers. In the old policy, it was 20 rupees for hospitals, and for labs, it was 15. Now it has been made similar for both hospitals as well as labs. The digital solution companies can be divided into two categories: the HMIS, LMIS providers, and second category is of the health lockers and the teleconsultations. They both are eligible for incentives of ₹5 per health record. Now, this eligibility criteria, as sir also mentioned, that it is going to be effective with effect from 1st April 2020, which means that the facilities which are already eligible for incentives, if they have some eligible transactions from January 1st to 31st of March, they would be paid as per the old policy. And if they are eligible for the transactions after 31st March, they would be eligible as per the new incentive policy. Now we have removed the bed count criteria for the hospitals. It was initially hospitals more than 10 beds are eligible for this incentive scheme. However, the criteria of soft linkage with ABDM, it remains the same. The labs and the radiology centers, which are registered in the health facility registry as the imaging centers or the diagnostics labs, that criteria remains the same. The third entity, which is the digital solution companies, the criteria of digital solution companies associated with at least 10 facilities, be it hospitals or labs, it remains the same. However, for the lockers and the teleconsultation entities, the base level of transactions was initially 2000. It has now been revised to 500. Coming to more detailed criteria for the hospitals, the clinics, and the nursing homes. Now, the base level criteria, which was initially for the hospitals as 50 times per bed per month, it has now been revised to a standard figure, which is 100 transactions per month. Now, up to 100 transactions, the hospital will not be given any incentive. The incentives are going to start after the 100 transactions. For example, if a hospital does 200 transactions, now for the first 100 transactions, there would be no incentive given. Incentive would be given after those 100 transactions, which means if a hospital does 200 transactions, it would be given 100 into 20, which means hospital would be given 2000 as the incentive. This criteria is the same for labs as well, which also has the capping of minimum 1000 transactions a month. And the same incentive is also given 20 rupees per additional transaction above 100. Coming to the digital solution providers, HMIS, LMIS. For HMIS and LMIS, we would be giving as per what the hospital has actually done the transaction. For example, the first example which I just gave, that if the hospital does 200 transaction, then the hospital is going to get 100 into 20, which means 2000 rupees. Now, if the DSC, which is already having its function in that particular hospital or lab, that would be given 100 into 5, which means 100 transactions into rupees 5 per transaction, which means 500. Coming to the digital solution companies which are having locker services and the teleconsult services, we have kept the base criteria as 500, which means up to 500 transactions, there would be no incentive given. After 500 transaction, again, it would be given rupees 5 per additional transaction above 500. This slide actually summarizes the comparison between the new policy and the old one. As I mentioned, for the hospitals, we were initially having the bed criteria for the 10 beds. We were giving 50 times per bed per month as the incentive. Now it has been made into a standard figure, which is 100. The 100 is the base, and we are giving 20 per additional transaction above 100. What is the comment, Pankaj? Okay, I'll be a little louder, sure. So I was mentioning that initially we had a criteria of the bed count for the hospitals. Now it has been revised. We have made it standard as 100 transactions, as I had explained in the previous slide. For the lab also, we have revised the minimum cap. Initially it was 500. Now we have revised it to 100 transactions. Also for the lab, we have increased the incentive per record. It was initially 15 rupees per health record, and now it has been revised to 20, which is again the same as the hospitals. For the DSCs who were earning incentives against small clinics, we were not giving any incentive to the smaller hospitals or small clinics in that case. But now even the smaller hospitals and the smaller clinics, the nursing homes, which are having less than 10 beds, they can also benefit under this scheme. If they do at least 100 transactions. Coming to the definition of transaction. Transaction is the creation of a health record using the ABDM enabled software plus the linkage of that created health record with the ABA ID or the ABA address. Now, if I just create ABA ID or the ABA address, that would not be counted as the transaction. It should also be linked to that health record. Then only we can call it a transaction. In addition to this, we have also started using scan and share. It is one of the major milestones for ABDM, the scan and share. We are generating 20,000 tokens every day. We have included the scan and share also as the transaction. However, I would like to make an important point here that the corresponding HMIS and LMIS entity of that hospital is going to be eligible for the incentives here and not the PHR app. The clause of minimum 1 transaction per day and 5 transactions per month is going to be the same, which means that if a patient undergoes 5 lab tests in a day, then out of those 5 lab tests, only 1 would be considered as a transaction. And if there are 50 lab tests in a span of 30 days, in a span of 1 month, then 5 transactions out of those 30 would be considered as the transactions eligible for the incentive scheme. These are certain documents which are required for the DHIS registration. The health facilities like the hospitals and labs, they can register in the HFR portal. And for the digital solution companies, we have the sandbox portal. The documents which are required, mainly there are basic 4 documents which are required. First is the cancelled check of the entity. Second is the PAN card. The third is the annexure form. And fourth is the bank mandate form. I'll just show what all the documents look like in the next slide. Now, in the previous policy, we had the additional incentive for the DSCs which were certified by the Quality Council of India. We were giving 20% extra incentive to them. However, in this new policy, we have removed that clause. No more these facilities would be eligible for the 20% extra incentive. Also, one more thing has been added in this policy, which means that still the calculation is going to be as per the month basis. But just to manage the administrative load, the incentives would be dispersed only if the entity crosses rupees 2,500 as a incentive value. I'll just take it as an example. Let's say the facility is eligible for rupees 1,000 incentive in a given month. We are not going to pay the facility at that point of time. However, once the facility has the total incentive, has the cumulative incentive as rupees 2,500, we are going to disburse the incentives at that point of time, but not till the incentives value is 2,500. This is the email ID abdm.incentive. You can also use abdm.incentives. Both are in the working condition. The claims are again processed as per two payments. The first is when the entity puts the claims before 5th of any month. That is the first payment cycle. And the second payment cycle is for those entities which put the claims after 5th, which means between 5th and 20th of the month. They would be eligible for the second payment cycle. These are the screenshots of some screens which we have taken as the hospital or lab, they log in into their HFR ID. This is how the screen would look like. Once they are eligible, the software linkage is done. They would be able to see this tab of register for digital health incentive scheme. As I mentioned, these are the four documents which would be needed. The bank mandate form. The bank mandate form is although no longer mandatory because we have removed it for now to maximize the registrations. However, while processing the claims, it would be required. The cancelled check, the annexure form is basically when the entity name and the bank holder name is different. So it is a certification from the entity. And finally, the PAN card. These are the some of the details which are required to be entered while doing the registration. The documents upload is this way. And once the undertaking is signed, there is a tab which says submit e-sign. This is how the e-sign document would look like. This is the screenshots attached for a sandbox, for a DSC when it tries to register in the sandbox for the digital health incentive scheme. Again, the DHIS registration tab would be visible, as you can see on the left-hand side. With this, I have finished the session. So we have seen today how the new policy is different from the old one and how we have incorporated few changes in the new policy so as to benefit everyone. Now we are open to question and answer session.
So there is one question received in the chat that are government programs also eligible? If so, how to register? Also, our facility is a virtual facility. Are we still eligible?
So what do you mean by virtual facilities? We'll have to find out about it. But government program, if it is like a PMJY or COVIN, we say that these are virtual programs and they will not be eligible. But if it is a telemedicine or a or a locker, then you will be eligible. So just clarify a bit more to us. If the person who has asked this question can unmute and clarify, then also it is fine to us. Who has asked that question?
Ariraj.
Okay. So Mr. Ajiraj, if you would want to speak.
Sure. Thank you so much, sir, for this session. I'm talking on behalf of National Viral Hepatitis Control Program, NVHCP. We just recently
NVHCP is not eligible. NVHCP is not eligible. It's a program and it's a virtual facility according to us. So
right.
Yeah.
So we're not eligible essentially. That's what I just wanted to understand.
Yeah.
Okay.
Yeah.
Thanks for clarification.
Yeah.
Hello.
Yes, Dr. Agarwal, please.
Good evening, sir.
Good evening.
Sir, my first question is related with the new edition is a scan and share.
Yes.
So that, sir, it means that any hospital has done 110 scan and share only.
Yes,
and there is no actually health record linkage, then what will be the position that he will get 20 rupees per 100, means 200 rupees incentive without creating any health linkage facility for which we are looking for?
that's right. So our assumption and our experience has been, Dr. Agarwal, is that health facilities who do scan and share transactions, generally they are also in the path of making more digital records. So we think that we want to incentivize scan and share transactions, and we believe that this will lead to more digitization. So in the condition that you mentioned, yes, they do 110 transactions, 110 scan and share transaction, 10 into 20, 200 rupees. They'll be eligible for the money. But we also believe that some digital records would eventually be made in the future by a hospital.
And sir, my second question very much related to this is about the milestone qualification of a hospital software.
That's
In a
right.
last meeting, there was a bit confusion at the panel level also that we may allow the M2 up to M1, M2, the incentives can be given. But now your current document clearly mentioned, that was clearly mentioned in previous document also, that is about the M3. I want to say that the free 3 milestone are compulsory to get a incentive for a hospital software.
That's right. For an hospital, M3 is compulsory. For a lab, we have made another relaxation, which is that till M2, if there is an lab management information system, we have allowed those LMIS to also claim incentives.
Sir, one healthy criticism is allowed on this panel, sir.
Yeah, sure, please. Why not?
Okay, sir. So today I have a very bitter experience with our webinar. I am in a constant touch with the PMJ from the last 5 years. I hasn't missed any webinar so far of any topic. I am a private consultant. Only today, sir, I failed to locate the link of webinar.
Yeah.
And I forced to scan the link webinar. And if we go to your website,
Sorry
it is
for
still
that.
mentioning the 9th March, which is actually very painful for me to see.
Sorry for that. Yeah. So that on the social media, I think we put a QR code, but yeah, we should have.
No, sir. Sorry to interrupt, sir. There is no such practice to just go for on the. We are not so advanced so far, sir. Our target audience is not so advanced. I am a 5-year-old with you with the NHA, and for the first time I get a hardship, and I have to know that how to get login. And if I get the link, I may spread it pan India, sir. Because let me add, sir, only 11 facilities, private facilities are on board. 5 are from my side. 4 is from Punjab. 1 is from Haryana. I do not get the support from my hospitals from Himachal and JK because they are feared that our money will be counted and income taxation also. And only 11 are there. And sir, I hope you will take a notice of this thing that
we
why.
have taken notice, Agarwal Sahab. We will in future make this link more visible on all our platforms and on the website and also on social media.
And sir, one suggestion that sir, please bring a calculator in front, because
we have a calculator, incentive calculator, if you would see on the website.
No, sir, that is there, sir. That is there, sir. But if it is possible on the home page, if we bring it, because very few people go to the menu to DHSI.
Noted. Yeah.
Okay, sir. I will take afterwards the few other questions, and if you allow me to speak again. Thank you, sir.
Sure.
Sir, good evening, sir.
Yeah, please.
My name is Pradeep, sir. I'm the district manager for e-hospital project. in Guntur, sir, Andhra Pradesh.
Yes, please.
Sir, my query is that in the GGH hospitals in Guntur, they have created ABAS created, sir, and they were doing scan and share very well, sir. And after registering a patient through ABA, they were creating EHRs. As well as admissions, as well as discharge, as well as treatment procedures, they were entering completely in the e-hospital.
Yes.
So how to link with that, sir? Because previous also they were done. The previous transactions will be implied to this or not, sir?
No, it will only start from 1st April. So only the transactions that would, the scheme is applicable, the revised scheme, the relaxed scheme we have mentioned in the corrigendum would be applicable from 1st April. So if you do scan and share transactions from 1st April, you will be eligible for financial incentives. So that is there.
Sir, as you mentioned for the labs also, sir, the patient should create ABA and go through the lab investigations and also.
Yeah, so there are two parts to it, NIC Guntur. I mean, first is scan and share. Scan and share, whatever transactions that you do, they would be applicable from 1st April. From 1st April, if you do a scan and share transaction and suppose then you make a digital record also, then primarily they will qualify as two different transactions, right? So that would be provided. And if there is a lab which also does scan and share, then it will also be applicable from 1st April. If they makes an ABHA linked health record, then we will provide incentives to them from 1st January. Provided they are more than the base level. I think 500 is the base level for laboratories from 1st January to 31st March. So essentially what we can do is we can classify the incentive scheme into two parts. First is the initial incentive scheme, and then it's the revised incentive scheme. So DHIS and DHIS 2. So DHIS 2.0 is from 1st April and DHIS is from 1st January to 31st March.
So actually, in the state of Andhra Pradesh, every government hospitals were using e-hospital software, sir.
That's
so
right.
By using the e-hospital software also, they were eligible to claim this incentive, sir.
That's right. Yes. Yes. So both are eligible. The facility or the hospital is also eligible, and the corresponding digital solution provider, that is the it is also eligible. So 20 rupees per transaction above 100, that hospital would be eligible, and rupees 5 per transactions above 100, that e-hospital would be eligible. So if suppose there is an hospital in Andhra Pradesh which does say 150 transactions, so additional transaction 50 into 20,000 rupees would that hospital would get, and 50 into 5, 250 rupees e-hospital will get. Does it make sense to you?
Yes, sir. Yes, sir. So e-hospital should also get registered in this digital health, this one, sir, incentive scheme.
So we are in touch with the e-hospital team at the center. We had done a separate session for the DDG, sir, Sunil Bhushan ji. So they are saying that they will register. I am not sure if they have already registered. Sangamitra, e-hospital has registered? They are yet to register. Yeah. So, but yeah, we are in touch with the NIC. Yeah. And they would register. Yes.
Sir, as far means like we are facing some issues, sir, regarding scan and share. While we are using scan and share, sometimes it's showing pop-up message showing as something went wrong.
Yeah.
Okay, we are unable to get the proper number of tokens, sir. But still, if they scan and share in the e-hospital website, the patient details and everything is visible. But while coming to the patients, there they are not getting the token number properly, sir. As well as while creating ABAS also, the OTPs issues are also still not yet resolved, sir.
So we will solve them separately. the good thing that I want to emphasize is that we are creating about 20 to 25,000 scan and share tokens a day. The OTP problem, we have been told that it is uh, quite resolved, but I would request one of our teammates to put Paras's contact details on the group, and Paras Kumar is our contact person for scan and share, and we want the scan and share to be very smooth. So I would request you to get in touch with Paras, and we would solve it. We would solve those issues.
Thank you, sir.
Ronak, you want to go ahead?
Hi, sir. So just one quick question, which is the current registration process for DHIS for a small clinic, right? So one thing is, which I wanted to understand is there an easy way where without logging into the HFR portal, they could be able to register them? So for example, for a TSP like say a Bajaj or an Ekacare or somebody for that matter who already has the process, how can we simplify the entire registration process of registering for DHIS? That is first question. Second is the incentive scheme payout. Is it directly made to the account of the small clinic, or is it routed via the digital solution company?
So answer to the first question, Ronak, is that we still have not enabled the functionality for the HFR, which has less than 10 beds to register. But only caveat also I want to say is that this revised scheme is applicable only for 4 months. While making this functionality, we can try and make that API open, but your companies would have to make more efforts. That is what I can say. It is a scheme which is only there for 3-4 more months as of now. If digital solutions are really very interested, then we would want to go ahead with this path. I'm not sure whether this would be the right way. If it is there, if whatever that is required from us to enable registration of small clinics through other means, you can tell us the requirements and we will communicate it to our team. If the effort is not large, we will be happy to do it. And the second point is that we have a policy wherein the incentives would be given to the clinic directly. It would not be routed to the digital solution. As Sangamitra had mentioned, that even if the incentives that suppose a hospital is getting, it is, for example, say 1,500 rupees, then maybe the clinic would have to wait for some time till it accumulates 2,500 rupees, and above which if the incentive comes, then we will disperse the incentive. We are, for information of everybody, we are in the process of integrating our DHIS system with the government PFMS system, so that whoever is eligible for the incentives, we will make direct benefit transfer like transactions like incentives. So we would not make it manually. We are integrating on the back end with PFMS so that the payments go, because we know that with this new corrigendum, there would be a lot of entities who would be interested. We right now have 133 entities which are registered on the incentive scheme, but with this new relaxations, I think close to 4,000 odd facilities and hospitals we expect that would be registered.
Okay. So I think just on the first point, right, because there are already a lot of technology solution companies today do collect PAN, Aadhaar, everything that you need for enabling a facility, right, to be able to register on DHI. So because we already collect the documents, it would be simpler for us to be able to pass it on an API or some of that matter so that it gets automatically registered, and then we can build that view for the doctor to give him a calculation that you will only be eligible after 2,500, and then once the payment happens, payment happening directly to doctor is not an issue at all. But the registration process Because already most of the companies would have those documentations available. It would be easier if it could route it via an API.
We will explore it separately. We will explore it separately, Ronak. I cannot comment more on that.
Sure, sir. Thank you.
Jaya. Jaya raised a question.
Yeah, sir. Thank you.
Yeah.
So my first question is, are multiple branches of a hospital considered as different entities in the DHIS scheme? And the second one is, should we create a care context for scan and share?
Let me try to address the first one. If suppose there is an SRL laboratory in Connaught Place, Delhi, and there is another SRL facility in Old Rajendra Nagar, New Delhi, then they are two different facilities, and both facilities will be eligible for incentives under the incentive scheme. Is the first one clear to you?
Yeah, yes, sir.
So when now coming to the second one, you would have to help me understand if I have understood your question correctly. You are telling that would there be a separate care context for a scan and share transaction? I would, I would like you to visit our scan and share page on our website. I would request one of our team members to post the link. So scan and share is just a use case. I don't think there is a separate user care context that is required for this. So if you are using an ABDM enabled HMIS or an LMIS, and that HMIS or LMIS has the scan and share use case, you will be eligible.
Okay, like I'm asking about the transaction during the scan and share. Just the, yeah. We don't have to create any care context there or to be.
No. For example, if you do five scan and share, like 105 scan and share tokens, then you will be eligible for 5 into 20, 100 rupees.
Okay.
Yeah.
Okay, sir. Thank you.
But it is also that suppose you create 105 scan and share tokens and you create 75 health records, then in all you have created 180 eligible transaction. The base level is 100. So you will get 80 into 20, that is 1600 rupees. So you can do both. You can do scan and share, and you can generate ABHA linked records. We would total both the transactions, the scan and share transactions, as well as the ABHA linked transactions. We would total it, and then whatever total that comes, we would subtract 100 from it, and then multiply it by 20 to give it to the hospital, and multiply it by 5 to give to the digital company.
Okay, sir. Thank you.
Yeah. Naveen.
Hello?
Yes, Naveen, we are able to hear you.
Yeah, I'm Naveen from the Drew Care. Actually, there are issues with the registration of DHIS also, because some of our client other day we tried to register for ABDM DHIS. So it was not, it was showing some error in the website.
Okay. Can you get in touch with Sangamitra? Sangamitra, can you put you on your contact details with that? We will help you we will help you with the registrations. You can also, for the interest of everybody, ABDM at .incentive@nha.gov.in. Just send us an email, and we'll be happy to help. Around 17 DSCs have registered, and about 100 hospitals and laboratories have registered. So we have not faced a lot of issues regarding that, but still we will address any issues if they are.
Yes. And also next thing is when we are trying to push the records, link the records, sometimes I don't know what's the issue. Is it from our end or ABDM or we don't know that, but it's not reflecting in the ABDM app, sorry, ABA app.
Yeah. So we'll again have our technical team touch base with. So integration.support@nha.gov.in. We will also, you also share your email ID and contact details in the chat box, and we will ask our technical team to get in touch. We do
Yes.
have some issues on and off with the ABHA app. So yeah.
Yeah, definitely. And one more thing is actually we are from like Hyderabad here, so no much people are aware of ABDM and ABA icons and everything. So I just request to please promote in our south part of India too.
Sure, we'll be happy to promote. I mean, awareness is one issue that we have heard requires attention in the entire country, not in South India
Yes,
alone.
I mean, yes,
But
I mean when we're talking about like ABDM and everything, but they don't know about it. No one knows this,
that's
you
right.
know. So we need more promotions from your end.
Yeah, and we need your support also to help in.
100%. I'm always tagging ABDM and
Yeah,
NHA in all the Twitter and everywhere.
yeah. Thank you for that.
Yeah. Thank you.
Yeah,
No problem. That's all
Krutikesh.
from my end. Yeah.
Hello, hi sir. Very good evening. There are two issues I am facing.
He has been muted.
With integration of our platform with you. The reason they stated was like the intention was unclear from our end. This is what they have mentioned, because we are a digital solutions company. We go by the name clickhealth.io. So I'll get in touch with Sangamitra for this. Secondly, there are two. There's a payment link now. When we are thinking it through into the future, I know this question may be relevant here, but when there are few doctors who want to get in touch with start using our facility for uploading the what we say check the health records and all, and for teleconsultation. We are starting with teleconsultation soon. For that payment getaways, we wanted to understand how this payment getaway would be. Like in the beginning, the idea was that the payment should go to the government portal and then it would be paid to the doctors and all. So we wanted to understand that.
I did not understand your question correctly.
Let me rephrase it. So when there is a teleconsultation happening over our platform through ABDM, that ABDM integrated platform, the doctors will charge for their consultation fees. The patient has to pay it to the doctors. So how would be NHA and ABDM be supporting this payment getaways?
NHA does not get in the payment part. It is only like whatever record that you are generating, it is linked to ABHA. We do not want to get the details of how much you charged. We do not want to come in between you and the customer.
Got it.
Yeah.
Perfect. And would there be any other like body who would help us with this, like some concerned person from ABHA?
But why do you need any help in that?
Because the doctors are questioning that if you are getting this integrated with the government, what is government's role in this?
Government's role is only limited to taking ABHA and giving the user the health record in his application, and if it is required, the user, if the user so requires, then he or she can share it with her prior consent to other care provider. Only that is the role of National Health Authority and ABDM. We do not store those records. We do not see those records. We just help enable interoperability.
Sure.
Have no intention to see what record is there, why it is there, which doctor was consulted. Only thing is, you go to a hospital. If you are using an ABDM enabled system, when you come back, you see the record on your mobile app. You see other records also there. And suppose you do a teleconsultation or you go to some other hospital, you can share those records, whichever you want, like 5, 6, 7, 8, or all records, with the user with your consent, and she will be able to see those health records. We don't want to come any part.
Sure. Thank you so much, sir.
Sure. Alok ji, you want to speak?
Hello.
Yeah.
Hello. Hi. This is Alok Barna. I'm on behalf of Plus 91 Technologies. I actually have a very small question. Previously, clinics were not eligible. Clinics who have OPD, they were not eligible for the DHIS scheme. But in this update, I saw it was mentioned clinics as well. So does that mean they are now eligible for the DHIS scheme?
Absolutely. I mean, that's the main purpose that we are doing this webinar. We saw that there were for the first 3 months the scheme was that there it was applicable only for hospitals which have more than 10 beds. Just wanted to correct you on that bit. Not IPD transaction, all digital transactions, all transactions, OPD. If there are OPD transactions also in the hospital, they would be considered for this scheme. We do not know, NHA does not know it is an OPD transaction, IPD transaction. What we know is that it is an Aadhaar link transaction. At the end of the day, we are able to see the HFR ID of the facility as well as the Aadhaar of the individual. From that, we will be able to give incentives. Now, in this scheme, what we have done is we received a lot of feedback that 90% of India's healthcare is provided by small clinics. Why don't you include them? Why have they been left behind? So in this scheme, by this corrigendum from 1st April, what we have brought in is that small clinics or big clinics, everybody who is there on the health facility registry, they would be eligible for the incentive scheme.
Right. Got it. Thank you.
There are some questions in the chat box before we give the mic to Dr. Agarwal. Chat box ko kholenge ek baar. ABDM Manipur had some question I saw. ABDM Manipur has been responded to the chat box. Okay, ABDM Manipur, you had some question I saw on the chat box. Okay.
Hello,
so if
sir.
all questions on.
Hello, sir.
Hey, did you have any question on the chat box?
Yes, sir. Actually, I have a question. Those HMIS which have got milestone 1, they are eligible for the DSI scheme or not?
They are not eligible. So in our, if you see the corrigendum 0.37, it says that for a hospital or clinic, each transaction should be done on a system integrated with the ABDM ecosystem till M3 stage. For a diagnostic facility or lab, a transaction done on a system integrated with the ABDM system till M2 stage will also be considered for calculations of incentives under the scheme for the lab and the DSC. So M3 for hospitals, M2 for labs.
Okay, sir. Thank you, sir.
Thank you. Dr. Agarwal. You are speaking on mute, Dr. Agarwal. You have to.
Oh, sorry, sir. Now I am audible, sir?
You are audible, yeah.
Sir, I have one suggestion, sir. As you mentioned previously that now this webinar is about the clinics because there was the condition of 10 beds and clinics were not able to participate. Sir, for my take that now coming time clinics will not again able to participate because they will be have a software which will be M1 compatible.
Why do you say that?
Pardon, sir?
Why do you say that they will have M1 compliant? There are a lot of software which are available to small clinics which are M3 compliant. I think 5 of them are like that, which are used in small clinics.
No, sir. Let me explain my point, sir. Let me explain my point. If a clinic want to be become ABDM compatible, when he goes, the clinic goes to the demo from the company. It can be DuraCare, it can be MediExcel, Atma. There is 6 to 7 well leader. The Hodo just get a triple milestone from Kerala. and their module is the full of so many facilities and modules are there that they are not in position to give only access to the OPD module. What the clinic will do with the IPD module, hospital management, HR, and the
Dr.
cost goes
Agarwal,
very up.
Dr. Agarwal, there are clinics, there are HMIS which are only for small clinics. Yeah. So they.
Even if you can see our dashboard or number of link records, so there are multiple clinics which are using the ABDM compliant solutions, and they all are M1, M2, M3 compliant solutions. So suppose if there are multiple which have already been, like one is there, Bajaj is there, and there are more integrators which have been integrating with us. So they are using, even in the areas like Dharavi and Mumbai, there are so many sub-regions in which doctors are happily using HMIS.
Sir, I agree with your point, sir, but my suggestion is that for the clinic purpose, if we can further dilute the guideline and give for M1.
होएगा ही नहीं अग्रवाल साहब, जब तक वो रिकॉर्ड नहीं बनाएगा, खाली आभा बना के करेगा क्या वो?
सर जब scan and share, okay sir, I got your point, sir. Okay. Point well taken, sir, because the main purpose is the health link.
Absolutely.
Yeah. I got it, sir, but we have to just see that how the private participation will get increased, sir, in a coming days.
And just for your information, there is also an HMIS which NHA had brought out, which is called as Doc Mitra, which is only for small clinics.
Again, sir, sorry to say, sir, healthy criticism. There is no, after having a 1 or 2 webinars, there is zero activity on Doc Mitra. I am in a part of the WhatsApp of the Doc Mitra. There is no post from the last 1.5 months, sir.
We will get the base, the latest updates, and we will share. Okay.
Yeah, definitely you share, sir, because there is not a, every time there was post from my side and there is no response. And there is no website, and I just request them to start the ABA generation, because the hospital need to know how to generate the ABA or link the ABA, which is not yet available on the Doc Mitra.
Sure. We'll get
okay, sir. Thank you, sir. Thank you for giving me time, sir.
Vibhor, can you quickly ask your question?
Yeah, I have a small questions regarding consumer medical devices, especially at-home diagnostic devices that people currently use today. So one is, so it's a two-part question. One is, what would be the categorization that ABDM would give them? Like, would it be treated as a diagnostic facility? And secondly, is there a plan to incorporate that as a specific category?
So the one part we would have to think about it before the thing that comes to my mind immediately is that this device would be kept in some hospital. So if it is kept in a hospital, then we can think of it being a part of that HMIS or the hospital facility. But you have mentioned about a record which is a device which is available with the person, and it could be then if it generates a record, then if it is available to the individual in their own personal capacity, it would be available as their own record. For example, suppose I have Google Fit on the phone, then then the details of my running and walking are available in my health app. So we would have to, I think a little bit more about how can we categorize or incentivize that device alone. To me, it appears that it would be a personal record of the individual.
Good. So there are currently two channels that people. So the most popular example would be like a pregnancy monitor, like a tracker kind of a device, which is given both directly as well as via hospitals. So ultimately, the consumer of this information are doctors at hospitals. So I mean, Like it's not in the it's definitely not in the hospital category because it's not kept at the hospital, but it's still generating some diagnostic, some vital sign data that needs to be shared.
Yeah. NIC Guntur, can you just ask, and that would be the final question.
Hello.
Yeah,
Sir,
please.
I have a quick question, sir. One thing is already one of the participants has mentioned, sir, for the advertisements and the publicity of this Abbas and everything.
Sure.
And as well as, if possible, give please provide an official, mail to the hospitals to start creating Abbas and use this one, sir, and create health records also, so that we e-hospital team was going to every day to the hospital, meeting the people, superintendents and all. They were not taking that much of seriously, sir. So if you please provide us the official communication to the hospital, so they may be passing the registration, sir.
Process is voluntary as of now. We can request the government hospitals. Surely we have been requesting the state government of Andhra Pradesh for that. We will again send in communications for the private hospitals. We just do it in a request mode, and we try to portray to them that this might be useful for them. So
whenever we are communicating them, they were just asking the same question, that we didn't get any official communication from the higher authorities. So those were the like that, sir.
Okay, noted. Thanks.
Thank you, sir.
Thank you, everybody, for joining the webinar. Our mood was not so good, but we were really very happy with the new corrigendum. We hope that this corrigendum would provide opportunity to you to utilize the financial incentives for accelerating adoption of digital health, and also supporting you in all the steps that you have been taken. We know that there is a lot of cost that is involved in digitization. So we wanted to support that cost, want to reimburse those costs. So we hope that we'll be able to do that. Thank you for joining. Thank you for all the cooperation. We would keep all our updates on our social media channels as well as on the website. Please be in touch with Sangamitra, Pankaj, Mehul, and on the email IDs, and we'll be happy to assist. Thank you so much.